Hi, and welcome back. Or if you're just joining us, I'm Ashlyn Smith, PA and founder of Elm Endocrinology and Lifestyle Medicine in Arizona. In this fourth video of our series, I want to talk about treating preclinical type 1 diabetes and how we can offer our patients resources and education to aid in their journey. As you'll recall from my previous videos, a positive screening result with 2 or more autoantibodies and an understanding of our patient's glucose allow us to stage T1D. Staging is critical as it informs treatment. But before we get into pharmacological treatment, I want to make sure to point out that even with a family history, the diagnosis of type 1 diabetes can be difficult mentally and emotionally. As with all diagnoses that we share with our patients, it is so important to listen to their concerns, support them with empathy, and refer them for appropriate mental health counseling and care if needed. Help them to see knowledge as empowerment to care for themselves and prevent complications while normalizing feelings such as anxiety or anger. Okay, let's take a look at treatment stage by stage. As a reminder, in stage 1, the patient has 2 or more autoantibodies without clinical manifestations of diabetes, and their glucose is normal. In this stage, we are largely in a watchful waiting period, monitoring glucose at home and formally through a lab, so that we are able to detect disease progression. This stage is a great time to provide patients with education and what to look for in disease progression. Refer them to sites that are built for patients or have patient materials like Breakthrough T1D, autoimmunity screening for kids, and a beta way to learn more about type 1 diabetes. If the patient and provider are comfortable, stage 1 T1D can be monitored in the primary care clinic with consultation to experts as needed or as the patient progresses to stage 2. At stage 2, there are still no symptoms of diabetes, but the patient has 2 or more autoantibodies. Beta cells are beginning to decline in mass and function, and the patient has abnormal glucose. At this stage, routine referral to an endocrinology provider or expert in preclinical T1D is recommended for advanced monitoring and education. For our best chance at preventing DKA, we ideally want to get patients referred within 8 weeks because it can take a while to get in to see a specialist. In stage 2, we have a treatment option to offer. Teplizumab is an FDA-approved CD3-directed monoclonal antibody that can be given to patients 8 years old or older. It delays the progression to stage 3 type 1 diabetes by a median of 24 months. This is significant because it can give patients more time to learn about the disease, adjust their lifestyle, improve metabolic memory by reducing the time spent in critical hyperglycemia, and reduce the risk of having a serious complication like DKA. This extra time may also allow some of the youngest children we treat more time to develop their interoception as well as verbal and self-advocacy skills, allowing them to better be able to alert their adults to changes in their bodies, as well as their self-care skills to better manage clinical diabetes when the disease progresses. As I mentioned before, a timely referral is the best way to make sure that your patients have access to treatment before disease progresses. At stage 3, patients now have hyperglycemia diagnostic of clinical diabetes and may have symptoms of diabetes. If your patient is not already working with an endocrine or diabetes specialist, now is the time to urgently refer them to one or to emergency treatment, depending on the clinical picture and risk of DKA. It is important that they receive immediate training on glucose monitoring tools and insulin delivery if they have not already. Now, we just talked about how primary care and endocrinology work together to treat type 1 diabetes, but there is a whole care team that should be working with your patients. These include dietitians, social workers or counselors, behavioral health specialists, and certified diabetes care and education specialists. There is really no such thing as too early when it comes to bringing in those care team members. Our goal as PAs is to bring compassionate care to our patients who are juggling a new diagnosis and all of the adjustments that come with it. we have the ability to provide them with resources and referrals to make the journey just a little bit easier. And when we combine the ideas we've discussed in these 4 videos, dispelling myths about type 1 diabetes, screening appropriate patients, staging type 1 diabetes, and offering appropriate referrals and treatment, we have the opportunity to prevent cases of diabetic ketoacidosis, empower our patients, and improve their overall well-being. It has been a pleasure sharing this information with you. Thanks for joining me.